In this program, we'll demonstrate how to perform a sweat chloride analysis for cystic fibrosis testing at Children's of Alabama using the ChloriCheck chloridometer test system. Sweat chloride measurements are used in clinical lab settings for the diagnosis of cystic fibrosis. The ChloriCheck chloridometer test system determines the amount of chloride in human sweat using the principle of coulometric titration. With the addition of a chloride sample, the free silver ions form a non-soluble silver chloride precipitate, together with the free chloride ions of the sample. The period of flow of the generator current is measured during the titration process and is proportional to the chloride ion concentration. At Children's, we alternate between two machines, using one on one day and the other on the next day, to prolong the life of the chloridometers. Here are the things you need to get started. Apply the proper PPE for this testing: gloves, a lab coat, and face shield. The manual, called Sweat Chloride Using the Westcor ChloriCheck Chloridometer, may come in handy as you move through the analysis process. Have one nearby for your convenience. You will need a sweat chloride analysis daily worksheet. The ChloriCheck 100 millimoles per liter of a sodium chloride and distilled water standard solution, which is used as a calibration verifier and quality control solution to condition the buffer you'll be making. The ChloriCheck reagent set consists of 1 bottle of gelatin and 1 bottle of buffer. It's used as the titration matrix during the titration process. These materials are hazardous and should be handled according to regulations. A box of Elitech Group Sweat Controls, levels 1, 2, and 3. These are used as quality-controlled solutions. This box of sweat controls also contains the insert that has the lot number and ranges you will need to fill in on your worksheet. Check that the lot number on the box is the same as the lot number on the insert. Also check the expiration date. We will use the first block on the insert for chloride on the chloridometer for sweat control levels 1, 2, and 3. Make sure you have a holder for your items. Have a breaker sleeve to open the glass items. You'll also need a stir bar to help mix the working solution. A 15 microliter pipette to measure the amount of sweat sample from the patient. A 10 microliter pipette to accurately dispense all the controls and the patient samples. Pipette tips. 1 silver cathode, which is the black electrode, and 1 silver anode, which is the red electrode. A 2-prong measurement electrode, a dry pink cloth, a blue cloth, Chemtech wipes, and finally, patient sweat samples. Over time and use, the anode silver electrode, which has the red housing, will be used up as it precipitates with the chloride ions. This electrode will have to be replaced periodically as it gets smaller. As long as the ChloriCheck passes quality control, the anode is still usable for sample measurement. Weekly maintenance is required on the electrodes to keep the chloridometer in top working condition. They are somewhat flexible, so care should be taken not to bend them. To clean the electrodes, you need 1 soft dry pink cleansing cloth and 1 blue cleansing cloth that will be dampened with deionized water. Clean the long end of the electrodes by rubbing them first across the dry cloth at an angle like this, rotating them to clean all sides. When you see gray appear on the cloth, you know you are cleaning them properly. Repeat the process on the blue cloth that has been dampened with DI water. Again, you should see gray on the cloth. Rinse them with DI water. Then dry them with Chemtech wipes. They should appear shiny and silver. Now you're ready to move forward with your analysis. You should have gathered all the things you need. Remove the insert from the sweat controls box. Compare the lot number on the box with the lot number on the insert. They should be the same. Check the expiration date and record the lot number on your daily worksheet. Remove the protective cover from the chloridometer. First, we'll make up the working solution. Place the cup in the chloridometer. Drop the stir bar into the small beaker cup. Put 20 drops of gelatin solution into the buffer solution. Turn it gently to mix, then pour this working solution into the small beaker cup. You now have 10 milliliters of working solution. Now gently insert the short side of the electrodes into the electrode carriage according to the colors. The red one goes on the left, the black one goes on the right, and the two-prong measurement electrode goes in the center. It has 3 pins that need to fit into place, so gently twist it to fit. With the electrodes in place, turn on the power button at the back right side of the chloridometer. Instructions will appear on the screen. Choose Measure. Now pull down the electrode carriage very gently, making sure the electrodes don't rest directly on the stir bar. The stir bar should be in the middle of the 3 electrodes. Next, the screen asks if you are ready. Press Ready. All specimens, including the standard solution and controls, should be run in duplicate. Your next instructions will appear. You are ready to condition the working solution. Break open the standard solution and use the 10 microliter pipette to accurately deliver 10 microliters of the standard solution, allowing the sample to drop into the working solution. Place the loaded pipette tip as near as possible in the center of the stirring working solution. Avoid dispensing the sample near the electrodes or sides of the beaker. There are grooves along the side of the electrode carriage to help guide your pipette. The screen should now read Conditioning Successful. If conditioning is not successful, chances are that the electrodes are dirty. Try cleaning them again or wiping them off with DI water. Other ways to troubleshoot include trying a different standard or making up a new working solution. Please see the manual for more information. Now mix up the standard and run it again. Use the 10 microliter pipette to accurately dispense 10 microliters of the standard solution, allowing the sample to drop into the working solution and record the measurement. We have achieved the expected results of these 2 runs. Now we can begin 3 control runs in duplicate. Gently turn the level 1 control to mix it up. Then open it with a breaker sleeve. Just as we did with the standard, use the 10 microliter pipette to dispense 10 microliters of the level 1 control above the working solution. Testing the control levels 1, 2, and 3 should result in numbers that are within 2 millimoles of each other. The number that comes up on the screen must be compared to the range number provided on the chart on the package insert. For this first level 1 measurement, we got a number that is in range according to the package insert. Record this number on your worksheet. Since we're running everything in duplicate, we'll run this again and use the 10 microliter pipette to dispense 10 microliters of the level 1 control above the working solution. Our second run on the level 1 control is in range according to the insert. Record this on the worksheet. Now we can move to the level 2 control. Gently mix it up and open it with a breaker sleeve. Use the 10 microliter pipette to dispense 10 microliters of the level 2 control above the working solution. Check this result with the package insert. It's in range. Record this number on your daily worksheet. Now run the duplicate test for level 2 control. Checking this result, with the package insert, it is in range. Record this number on your daily worksheet. Repeat the process in duplicate for the level 3 control. Gently mix the level 3 control solution and open it with a breaker sleeve. Use the 10 microliter pipette to dispense 10 microliters of the level 3 control above the working solution. Record the number on your daily worksheet. And now the duplicate for level 3. Record this on your daily worksheet. All of our controls, level 1, 2, and 3, were within range according to the insert and within 2 millimoles. We can now move on to the patient sweat samples. It's important to know that the chloridometer can detect other halides, such as bromide and iodide, in addition to chloride. Therefore, if a sweat sample contains other halides in addition to chloride, they will be detected and can falsely elevate the sweat chloride result. A patient's skin must be properly cleaned prior to sweat collection so that false positive results can be avoided. The patient samples must measure at least 15 microliters of sweat from each arm. If a patient sample is QNS, meaning the quantity of sweat is not sufficient to perform the analysis, the doctor will be notified. If this occurs, the patient will have to have another sweat collection performed. The sweat is labeled on tiny tubes for left arm and right arm. Patient sweat samples are hand-delivered from the clinic to the lab immediately after they are collected. Sweat is viable for analysis for 72 hours. At Children's of Alabama, we perform the sweat chloride analysis as soon as a sample arrives in our lab. The patient's name and medical record number, as well as the accession number for this lab test, are documented on the worksheet. Verify that the patient information on the sample tubes matches the patient name and accession number on the worksheet prior to sweat measurement and analysis. To be sure there are 15 microliters of sweat, use the 15 microliter pipette to measure the sample. This is the only time we will use the 15 microliter pipette, so it is a good idea to put it away once the quantity of the sweat sample has been measured to ensure it isn't accidentally used during the patient analysis. The worksheet has a box to verify the amount of sweat volume. We'll begin our patient sample on the right arm and check the box to verify that we have greater than 15 microliters of patient sample on this side. We do have enough for this patient sample. If a patient sample has less than 15 microliters, mark the appropriate box. This sample would then be labeled QNS. Now we begin the analysis, just like we did for the controls, and perform everything in duplicate. Use the 10 microliter pipette and dispense 10 microliters of patient sample above the working solution. Record the result on your worksheet. Now for the duplicate run on the right side. Again, use the 10 microliter pipette and dispense 10 microliters of patient sample above the working solution. Record this result on your worksheet. You can now record the average of the two runs. Moving to the patient sample from the left arm, we do exactly the same thing. Verify there are at least 15 microliters of sweat and check the appropriate box. Use the 10 microliter pipette and dispense 10 microliters of patient sample above the working solution. Record this result on your worksheet. Repeat for the duplicate run and record your result. Now calculate the average for the left side. The averages of the right and left side should be within 10 millimoles of each other if the number is equal to or less than 60. The averages of the right and left side should be within 15 millimoles of each other if the number is greater than 60. The averages are reported to the physicians. If a test results in less than 10, then it is reported as simply less than 10. Sometimes there is only enough patient sample to run the first test, and not enough for the duplicate. In this case, we would record the first run and report that there was no duplicate. Average results above 60 are positive for cystic fibrosis, and the physician is notified right away. To begin another patient, check the chloridometer screen for number of samples run. You can run 50 samples before you need to change the working solution. If no sample has been measured for 5 minutes, the machine should be in standby. Then simply move down to the next row on your worksheet. Run the standard and controls again, and begin the process of analyzing patient samples in duplicate. At Children's of Alabama, we run up to 5 patient sweat analyses each day. You can use the same worksheet for all of your patients in one day. If the measurement mode is suspended between patient samples, it will be in standby mode. Simply press the Continue button to begin the next sample. Once we've completed the sweat chloride analyses for the day, we log all of the results in the computer. Now, here's what to do when you're finished using the chloridometer. Throw away all of your controls, any remaining sweat samples, trash, and other items in the biohazard container. Put away the holder and breaker sleeve. Press Exit on the screen and follow the instructions that come up. Raise the electrode carriage. Remove the beaker cup. Use a magnetic stick to remove the stir bar. You can rinse and save the stir bar. Dispose of the working solution. Rinse the cup with DI water, dry it, and return it to the chloridometer. Remove the 3 electrodes. Rinse them with DI water and dry them with Chemtech wipes. Then put them back in their containers. Press Done on the chloridometer and return to the main screen. Now power off the chloridometer and put the protective cover over it. This concludes the demonstration on performing sweat chloride analysis for cystic fibrosis testing. Please consult your procedure or your operator's manual, or contact technical service if you have any questions or need more information.